Let's shed light on PCOS or polycystic ovary syndrome, a condition that affects many women but doesn't define them. Now, from hormonal shifts to stubborn symptoms like acne and irregular cycles, PCOS can be a challenge, but it's manageable with the right care. Remember, small steps like a balanced diet and active lifestyle can lead to big changes. Let's own this week with strength and self-care. Now, to tell us more, we have Dr. Issa Matibag Quiaoit, obstetrician and gynecologist. At the same time, she's a content creator who talks more about PCOS through various social media platforms. It's a beautiful day, Dr. Issa. Good morning.
Hi, good morning, everyone. Thank you so much for having me on the show.
Great to have you on the show today, Doc. Looking very bright and pretty this Monday morning. Now, first and foremost, Doc, let's define PCOS. What is polycystic ovary syndrome or PCOS, and what are its main symptoms?
Yes, so polycystic ovarian syndrome or PCOS, so that's what it stands for. To diagnose PCOS, we have three criteria. We have irregular menses, which is the first criteria. The second is signs of hyperandrogenism. This can manifest as hormonal acne, excess facial hair, that is hirsutism. And then the third one would be polycystic ovaries on ultrasound. So those are the three. You only need 2 out of the 3 to be diagnosed with PCOS. And it doesn't mean that if you have an ultrasound that says that you have PCO or polycystic ovaries, doesn't automatically mean that you already have PCOS. So you need 2 out of the 3 criteria.
Doc, of course, you make content with regards to this. You make content in general with regards to medical conditions. But then, why should we talk about PCOS more? Is it something that is relatively undiagnosed here in the Philippines? And of course, how can that type of content really help educate those who need to get checked and need to be diagnosed with this?
Yes, that's right. Currently, 1 out of 10 women are diagnosed with PCOS, and I'm pretty sure that there are a lot more people who are undiagnosed because there's a lot of stigma sometimes of going to the OBGYN, and so some females are still afraid to approach us to diagnose them if they have irregular menses or any other symptoms as well. So I'm pretty sure this might be an underestimation of the incidence right now. But again, it is very important because it can impact other features of your life also. So it can affect your metabolic condition. It can affect you physically, mentally, emotionally as well. So yeah, there's a lot of other factors that can be affected when you do have PCOS.
Doc Issa, now as a woman myself, the number you just said, the 1 out of 10 women get PCOS. So I'm kind of nervous. Can you tell us what causes PCOS, and is it genetic or is it more like a lifestyle thing that contribute to it?
Actually, it's a mix of both now. So yes, there is a genetic factor to it, and then there's also a lifestyle factor to it, right? So one of the major causes of PCOS, aside from the genetic or the family history, could also be insulin resistance. So insulin resistance, when you have it, it causes your insulin to spike up as a compensatory mechanism, and what it does is also raises your androgens or the male hormones in your body, and this can lead to irregular menses, other signs and symptoms like what I mentioned earlier, like hormonal acne, excess facial hair. It can also cause skin tags, hyperpigmentation, and it can increase your risk for other conditions like diabetes. It can also increase your risk for endometrial cancer and other diseases as well.
You know what, Doc? You mentioned lifestyle. No, this is a lifestyle thing, yung PCOS. And one of the major symptoms that women are really bothered about is yung weight gain, the uncontrollable weight gain when you have PCOS, right? Because I see some of my friends who are suffering from PCOS, yun ang pinaka-concern nila eh. They really can't control. They exercise every day, but it's really uncontrollable, no? What are the physical activities and exercises that they can do to improve PCOS management? And not just exercise, maybe diet also, no? Diet management.
Yes, so one of the ways when I advise my patients, so when it comes to the proper diet, of course, a calorie deficit may be helpful for some women. Avoiding food such as red meat, inflammatory food like increased food and trans fat, or those with preservatives, and even those with oily, fatty food. You can avoid those. And when it comes to exercising, zone 2 exercises, what you can, where you can raise your heart rate to around 60% of your maximum heart rate. So like cardio exercises, even as simple as brisk walking is already helpful for patients with PCOS.
Doc, there's a question here that I have no right to ask. So I'm going to ask Mo to ask about this instead. Because apart from obviously the weight gain that Anne mentioned, there are other factors that PCOS does affect. So Mo, again, you should ask this.
Well, Paolo's also curious, Doc, but how does PCOS affect fertility? And what are the treatment options for women who are trying to conceive?
Yeah, so when we approach patients who are having difficulty conceiving because of PCOS, of course, we do have other treatment options. So PCOS, when you have it, you are not ovulating. So this is the one day in a month, so the 24-hour window period that can where your ovaries will release an egg cell for you to get pregnant, right? And when you are not ovulating, so we do have treatment options to give ovulation induction drugs like letrozole or clomiphene. And if that doesn't work, then we can also refer you to an infertility specialist that can also help you with other procedures like intrauterine insemination or IVF as well.
Doc, here's a question I can ask. Can you tell us a bit more about the role of insulin resistance? Because we're talking a lot about hormones, we're talking a lot about the chemicals in the body, and insulin is going to be one of the factors that PCOS does affect. Could you tell us a bit more about how it can be managed?
Yes, so for insulin resistance, of course, the first line management is still the proper diet and exercise. But there are other treatment options medically. So some doctors prefer giving metformin. There are some who also give myo-inositol and D-chiro-inositol, which are insulin modulators. There are also some supplements that are approved, like omega-3, vitamin D, probiotics, even vitamin E as well, and CoQ10. So these can also help. But of course, if you are planning to take these, you need to see your OBGYN to see what's best for you.
Doc, I'm actually really curious, is PCOS, is that a forever thing? Like, is it curable, or you just have to manage it once you have it?
Yes, when we diagnose you with PCOS, yes, it is a lifetime diagnosis and it puts you at risk for other conditions like what I mentioned earlier, like type 2 diabetes, endometrial cancer, and all of these. But of course, the symptoms can be managed. So if ever you do have irregular menses, or if you have excess facial hair and uncontrollable hormonal acne, then yes, it's time to see your OBGYN so we can help you manage these symptoms.
Doc, you know what? When you look at the symptoms of PCOS, and the symptoms of perimenopause, parang magkapareho sila di ba? How can you tell that what you have is actually PCOS or perimenopause? Meron bang age group na ito, when you have this at a certain age, PCOS yon? Or how can you tell?
Yes, so PCOS really affects those in the reproductive age. And menopause, usually that happens in your late 40s. So by age group, yes, they are very different. However, it can, of course, transition later on. And we do have tests for menopausal or perimenopausal females so that we can differentiate the two as well.
Well, let me check first if I can answer here ask a question here that is not inappropriate for me to Doc, mental health with regards to PCOS. I mean, like you mentioned it a while ago that there are different factors with regards to how this can affect someone emotionally and also from a mental health perspective, not just because of the PCOS, but then because people are afraid to go to see their OBGYN and seek medical help. What advice could you give with regards to that?
Yes, that's right. So PCOS does also raise the risk of developing depression, anxiety, and of course, it really does impact the the mental health of these women, of course. And when you have PCOS, when you go to the doctor, it's also very important to the doctor to screen their patients for these things. And so we can actually give the right referral to a psychiatrist or to a therapist as well in case they are struggling with this. A lot of self issues, of course, can be managed by a therapist or a psychotherapist as well. And so being able to screen them at during when they are in the clinic is also very important as well.
Doc Issa, we still have a lot of questions to ask you. Unfortunately, we don't have enough time. But where can we get in touch with you? Where can we reach you? And also follow you on your socials?
Yes, thank you so much again for having me on the show. If you do want to learn more about general OBGYN, reproductive health, and sexual health as well, you can follow me on Facebook, Instagram, and TikTok at obgynoncall.ph. Thank you so much, everyone.
Thank you, Doc Issa, Dr. Issa Matibag Quiaoit, right there, obstetrician and gynecologist, joining us this morning.
Thank you so much, Doc. And of course, it's just...
Nakakatuwa ka, you were selecting your questions.
I know, behind the scenes, behind the camera, I was like, I can't ask this, Mo, you got this.
There are literally some questions I think it's more appropriate if the two women on the show actually do ask.
I know.
Papa out here talking about menopause, now PCOS.
I know, right?
I love it. Educating women out here left and right.
And you know what? As a guy, we gotta understand too, right?
Yeah.
So,
That's
syempre, but at the
And
same
it's also
time...
nice to know about these things. So once your partner, goes into that age na and experiences those symptoms, you would understand. You know how to.
But here was another question I was going to say, because PCOS is not necessarily for the older
No.
older,
More younger,
yeah, it could happen to the younger ones also.